We have presentations tonight by Kara Sutherland, Healthy Eating and Recreation in Municipal Setting. Would someone like to move for Kara to come forward?
So moved.
Is there a seconder?
Second.
All those in favor?
Aye.
Contrary minded, motion carried. Kara, would you like to come forward?
Sure,
Oh,
Lisa's
you're-
actually going to start us off. Yeah.
And you are
Lisa McAlpine. I'm a
And
health promoter with Public Health Services.
health promoter?
Health promoter with Public Health Services, serving
Mhm.
Beacon County.
Okay, and is everyone okay with? Okay.
Thanks. So thanks for giving us the opportunity to present to you tonight. We're here, as Warden Gregory already indicated, representing the Digby County Healthy Eating and Recreation and Municipal Settings Committee. It's a mouthful. And as I already indicated, I'm Lisa McAlpine. I'm a population health promoter with Public Health Services, serving Digby County. And I'll just allow my colleagues to introduce themselves as well.
Hi, I'm Kara Sunderland, an active living coordinator with Digby Area Recreation.
I'm Heather Bailey, Public Health Nutritionist with Southwest Health.
Are you being able, Pat, are they going too fast? Oh,
Yes, but I'm getting the gist of everything. I know Lisa, I know Kara.
Okay. I'm just, excuse me, I just want to comment. Pat is our new executive assistant and taxation officer. So this is her first night, even though she's been with us many years, this is her first night in
And I
her
have
new
taken
position.
this before, but not this.
I can send
That's
any
why-
additional
That's why I
information
was
along.
checking, because it's new. And I wasn't trying to break in, but I just want to make sure she was getting who we
Yeah,
are.
sure.
If
Okay,
you have any
so-
questions tomorrow, we can always just give me a call and we can fill in the blanks.
Hi, I'm Emily Buck. I'm a dietetic intern with Southwest Health.
And my name's Andrea Gadet, all the way from the municipality of Clare. I'm the recreation director there, supporting the initiative for Digby because we're doing it in Clare as well.
Great. So basically, we're here to ask for your support in developing a policy that will allow a supportive environment for healthy eating in municipal settings. And before we get into the presentation, I'd just like to acknowledge Dr. Sarah Kirk with Dalhousie University. We've adapted our presentation using some of the slides that we've taken from a presentation that was developed by her a few years ago. So, we're here to talk about a healthy and safe community, and that's a concern for all of us, and having access to nutritious, healthy food is part of that. Research is clear that our food landscapes and environments do have a significant impact on the health outcomes of the community. So when we start to discuss the concept of healthy eating policy, a lot of issues or statements or questions arise from groups and individuals, and one of those is that everyone has the right to choose to eat whatever they want. Well, that's certainly correct, but currently the default choice in our environments is unhealthy food. We need to create an environment that makes eating healthy food easy. And just to build on that, you can go to any town or city and see areas like this. They're often referred to as fast food alleys. And we talk again about an individual's right to choose, and having the right to choose is important. But what's often lacking in environments like this is access to healthy foods. There's often unlimited access to fast food or unhealthy foods, but very limited access to healthy foods. And we live in a car culture, one where these unhealthy foods are readily available and heavily promoted. And we lead busier lives than ever before, so we're often looking for big, cheap, and easy when it comes to meals and food. And there's a misconception around healthy food that it can't be big, cheap, and easy, but it can be. And over the years, our portion sizes have doubled. In some cases, they've tripled, making these new supersized portions a new norm. And our food environments in our recreational facilities and vending machines often offer little to no healthy food options. It just seems counterintuitive to not have healthy foods available in these facilities that are supposed to be promoting healthy and active lifestyles. And another common statement or question or that arises when discussing healthy public food policy is, well, they're going to eat it at home anyway. Well, if they're making poor choices at home, it's even more important to create a healthy food environment and recreation in municipal settings. It's all the more reason for you to take a leadership role and be part of the solution and not contributing to the problem. Not only have our environments changed the way that we eat, but they've also changed the way that we move. We move less, our children move less. Time that used to be spent playing outside is now spent in front of the screen. This decrease in physical activity and poor nutrition habits have led to staggering rates of chronic diseases. Childhood obesity continues to rise, and Nova Scotia has some of the highest rates in the country. 1 in 3 Nova Scotian children are considered overweight or obese. So I'm going to pass this on to Heather now, and she's going to talk a little bit more.
Hello. So consumers are required to be more nutrition savvy or literate than ever before, to understand some of the language that's used and what it all means. So what does good for you mean? Does it mean the sandwich, the drink, and a dessert? However, this meal contains 925 calories and 33 grams of fat. That's almost half the required intake of calories and fat. And the cookies have more fat and calories than the sandwich itself. So we can be persuaded by media and marketing. So we can't necessarily rely on media and marketing messages to be taking care of our health for us. They have other priorities, and their priority is making money. So speaking of money, there's big food put into food advertising and marketing by large, powerful companies. So to put this in perspective, the advertising budget for Coca-Cola is $2.2 billion, which is more than the entire budget of the World Health Organization. The problem is that children are increasingly becoming the target of marketing campaigns by food manufacturers. They try to make food look fun, using mascots and characters, creating characters or vibrant colors to attract children to the product. These are often foods that are high in fat, sugar, and salt, and lower in fiber or nutrients. We often hear the logic, but they've burned off enough energy, they can eat whatever they want. But if you do the math, this is a 12-year-old boy who weighs about 80 pounds. He's played a hard hour of hockey, and he's only burned about 290 calories. So a typical snack, he's being rewarded after hockey with chips, chocolate bar, and maybe some Gatorade. So this snack totals 708 calories, which we can see as a surplus. So he's not really creating that balance. And we could easily replace the chips or the chocolate bar with donuts or Timbits or whatever have you. The average fast food meal contains about 1,440 calories. So this is more than the number of calories for one single meal, and almost close to the recommended intake for the whole day.
What is the recommended intake for that?
On average, about 2,000 per meal. So you wouldn't have much more to eat the rest of the day if you were trying to stay within your caloric requirements. It would take about 8 hours of a slow walk, 6 hours for moderate, or 5 hours of a fast-paced walk to burn off that much. And then we say that would happen when pigs fly, because we really just don't have that much time on our hands. So all of these items mentioned are contributing to negative health outcomes for our communities. Southwest Health, for example, has the second highest rate of overweight and obesity in Nova Scotia. These statistics show that not only is 65% of the population over the age of 18 considered overweight or obese, they also show that this area is heavier than Nova Scotia and even more so than the rest of Canada.
But isn't Lunenburg ahead of us?
One municipality.
So short doesn't show my.
Yeah, isn't it Lunenburg?
Social health, yeah.
Well, I mean, we can feel Lunenburg.
We're not first, we're second. Yeah.
We're second, not first.
Our district health authority has the highest rate of heart disease in the province and much higher than Canadian stats. So 9.8% versus 7.3 or 4.3. The second highest rate of diabetes in the province, 10.5% compared to provincial rate of 8.5 in Canada.
Who's first?
For diabetes,
Cape
Cape Breton. So these are both largely preventable health issues with a proper lifestyle. So the Children's Lifestyle and School Performance Study, also known as Class 2, was a provincial-wide research project that studied the relationship between nutrition, physical activity, mental well-being, school performance, and overall health. The Class 2 was completed with over 5,000 grade 5 students across the province and their caregivers. This included 272 schools, including Digby Elementary. So these are the results from the Digby Elementary study. That 20% of grade 5 students were eating the recommended intake of fruits and vegetables, and 32% were achieving the recommended intake for grains and alternatives. They also showed that obese children have 21% higher physician costs than normal weight peers, and 3.4% of the healthcare costs in children are attributed to overweight and obesity alone. 1/3 of the grade 5 students in Nova Scotia were considered overweight or obese. Also, most grade 5 students reported that they care about eating healthy and they care about being physically active.
This study, was it done when the elementary still had a cafeteria?
It was 3 years
When
ago.
was it?
I think it was 2 years ago.
So they haven't had one for a couple years, have they?
No.
Yeah.
Just one. Spartan, not study on Spartan at all?
Spartan does have their own results, and so does Weymouth, but we don't have those.
Hopefully they're better, because they've been really working on.
They've done really well with the health supporting
Yeah.
schools.
Okay, so we have all this knowledge and facts. We have to ask ourselves, what does this mean for the health and sustainability of our community? And it really means that we have to change the way that we're doing things. We have to create some balance. And the good news is that there's lots being done nationally, provincially, regionally, and locally, but we're going to focus on what's being done in Nova Scotia. The South Shore has actually led the way with policy adoption, not only provincially but nationally. 4 out of the 6 municipal units have adopted healthy eating policies. The municipalities and districts of Chester and Lunenburg, along with the towns of Lunenburg and Bridgewater, have all adopted policies. And they actually made the national last fall, and we wanted to show you that news clip, but it's not working, so unfortunately we can't. But are we going to send them all links? We'll send you all links to the news story. And some other things that are being done in Nova Scotia, the new Truro Civic Center and the new indoor soccer facility in Bridgewater have all adopted facility healthy eating policies. And that tends to be the trend now. Any new facility that's being built, there's a built-in healthy eating policy. And there was a Thrive Provincial Strategy which was released last spring by the provincial government, which is essentially the childhood obesity strategy. And the focus on that is the built environment, so changing our physical environments through policy development and adoption. And And there were funding opportunities attached to that, and we did apply for funding, and we got approved for the maximum amount of funding to move the work forward in Digby County, so that's positive. And there's also a provincial HERS committee, healthy eating, recreational and sports settings, and I currently sit on that committee. And the primary mandate is to inform and support healthy eating initiatives at the provincial, regional, and local levels through the development and implementation of a strategic plan, and also to aid in policy framework development and implementation. And there's also lots of good work being done at the local level already in the municipalities of Digby and Clare. And I'm just going to pass it on along to Andrea and then Kara to talk about what they're doing locally.
Hi. So as I mentioned, I'm with the Municipality of Clare, the Recreation Director there. And for the last year, we've been meeting as a committee with Kara and the rest of the committee to work on healthy eating initiatives. But before we started meeting, the Municipality of Clare already started taking some steps to make some changes, although we don't have a policy. So some examples of things that we've done, a big example is our Canada Day activity. So that is municipally run, municipally led. And we used to have barbecue with hot dogs and mini sips and cupcakes. But then when I came aboard, slowly started making some changes. So now we don't have hot dogs, we have hamburgers with whole wheat buns. And we have watermelon instead of cupcakes. And we have water and juice instead of mini sips. So it was a slow change. So the first year was just changing from hot dogs to hamburgers. The second year was taking the mini sips out, bringing in the juice, and then after that it was the watermelon. And we still have a Canada Day cake, but instead of having an activity of decorating the cupcakes with the kids, we have an activity of decorating masks with Canada Day, decorations. So that's just one example of how we started to implement change. Our next step is, next week we're going to be going to the Municipality of Clare, doing the same presentation as with this municipality and asking them to give us a go-ahead to work on policy. So it's just an example. Any questions on that?
So as a recreation department, we also have already started to make some changes to support healthy eating and healthy lifestyles. So one example we have is we've started swapping out cakes and cookies and putting in tangerines and bananas and watermelon at some of our special events and celebratory events. We've added 100% juice and taken out some of the soda that we've had before. We use whole wheat buns at our community barbecues and staff events. And we also encourage our day camp participants to bring healthy lunches. So we do that by providing the parents education at the beginning of the summer on what constitutes a healthy lunch, because we can't assume that everyone knows. And then we also lead by example. We have our counselors make sure that they bring healthy lunches when they eat with the kids, so they see them doing it, so they want to do it as well. And it doesn't help, it helps that we give out prize too for healthy lunches. We also provide healthy snacks at all of our after-school events, so the Tri-County Regional School Board and Nova Scotia Health and Wellness helps us fund that, and we make sure that any of our after-school events, we have cheese and crackers, apples, oranges, and juice. So that's some of the stuff that we've already been working on without having a policy, just knowing that it makes sense. It's a good partnership with health and recreation to follow both. So what can you do? There is a lot that you, as municipal council and community leaders, can encourage in a healthy food environment at your facilities and your events, creating healthier communities and healthier residents. You can develop a policy to provide healthy foods at municipal facilities and our municipal-led events. Work in partnership with public health, Nova Scotia Health and Wellness, and other interested sectors to ensure that we create healthy communities. We can question what's being done as a status quo, and we can talk about this epidemic. A policy might look like the following. A healthy eat policy will be a phased-in approach, hopefully over 3 to 4 years, every year increasing the amount of healthy food that you offer and decreasing the amount of unhealthy food. The policy could also follow the Nova Scotia School Board policy with the minimum, moderate, and maximum food categories, meaning that foods are classified by the amount of nutrition that they provide. Events and facilities would be allowed to serve a certain percentage out of each category. A policy might not apply to food and beverages brought in by employees, organizations and individuals that rent space. However, they should be encouraged to follow policy if they are using the space, however, it's not required. Alcohol, coffee, and tea that may be served at events or facilities as well. So the next step in the process is for you, as municipal council, to stand up and take a stand to become part of the solution. We want to have happy and healthy residents who live in a healthy community. We are asking you for your support in developing policy for the municipality that will allow a supportive environment for healthy eating. Does anyone have any questions on the presentation?
No, Deputy Warden.
I have one. In regards to the arena, the Minor Hockey Association leases the space from Dark, and so they have a separate contract. Have you talked to them to see what they can do to bring in healthier alternatives into that space?
Yeah, in the policy, they could be considered an exemption as someone who's renting space because they do rent from the arena. However, as a committee, we've been working throughout the valley from Windsor down to Clare. We got $9,000 in Thrive funding to work with the arenas to provide them with equipment, purchase equipment to be able to make healthy foods. We have a chef from Nova Scotia Community College who's working with all the arena canteens to develop menus that provide healthier foods for people to choose from, and foods that are going to be affordable and easy and convenient for the canteen operators, because we know that they're volunteers and they're not going to get up at 5 o'clock in the morning to make a healthy meal to serve the canteen. So we've been working with the canteens already.
Yeah, like with regards to foods or snacks in the canteen, with Dark leasing, having a lease, you would think that they could have a provision in the lease when it had to be renewed on maybe a percentage of food had to be healthy or whatever. Just throwing that out there. But the other thing is too, you'd have, instead of chocolate bars, you'd have apples and oranges and tangerines. I know years ago, hockey teams used to take oranges into the fighters, like, you know, in between periods. But I don't know, that's maybe unheard of now, I don't know. But
Councillor Stelfine has hit the nail on the head here. Yeah, they do at some tournaments, they do take the oranges in still, but not from the canteen. Like the canteen wouldn't have any fruit to offer at this point.
I'm just throwing that out there, that that's where it's got to start from though, because if you go into the facility and the canteen only has chocolate bars and chips and fried food, you don't have any options for healthy eating. So it's got to start there, I think.
That's right.
Councilor Judith?
Oh, the numbers you gave are certainly alarming. I reminded the it's cheap to get calories, but nutrition is expensive, and I think that's really is true. Just from going to the grocery store, you know, it's you get 2,000 calories in a bag of Doritos for $2, and it's $4 for a bag of spinach. I wonder if there's any income correlation between income and weight-related health complications in this area. I know we're a little lower on the average income bracket. And is there any thoughts towards making nutrition more affordable, or for ideas along those lines?
Speaking on the affordability part, that we could have an effect on, like in canteens and what we offer in municipal facilities. We do have a lot of research on what can be offered and price point as compared to junk food, and there are a lot of alternatives that we know that that can be less expensive than a bag of chips, if not the same price.
Kara, do you still have those slides of the economic?
Is it
Yeah, there's a little cost analysis here, just indicating like the wholesale cost of different products, and we actually have literature as well. Can you check the other one? Comparing the less healthy food options to the healthy food options, and in most cases, there's more profit selling the wholesale cost is more for the unhealthy food than it is for the healthy food. And there's a lot of literature around price adjusting too, to make the healthy food options more affordable. So making the less healthy options a little bit higher in price to offset the cost of the healthier food items. But you are right, there's a direct correlation between socioeconomic status and, you know, whether the health outcomes. You're definitely right.
So this is drop in the bucket, but hey, another drop in the bucket's good. That's why
Yeah, but there is a lot of research around how to price things effectively so that the healthier options would be as cost effective or even more cost effective than the unhealthy food options.
This past week I had a meeting at the Meadows, which is equivalent to Tiger Terrace here. And they have a tuck shop, which is like what we would call a canteen. It's called tuck shop. And I wanted something for a snack, so I went out to the tuck shop. They not only had the tea and coffee that they wanted, or juice, but I looked and I said, oh, I'll have some cheese and crackers, which they had there. I said, I will have the, you know, the raisins, the nuts, and the mixture.
use it.
What do you call it? Trail mix. I spent less than $2 on those treats than I could have bought their bag of chips for $2. They did have chips there, but they were $2. I just thought, well, this is a senior, and they had apples, they had oranges, they had, you know, different things there, and so I was talking to the volunteer, he was a volunteer, and I said, does your fruit go rotten? She said, well, no. She said, people pick it up all the time. She said, the staff here are great about wanting fruit. She said, and she said, most of our, she didn't call them seniors, but she said, most of our group, you know, we like sensible snacks or something like we're used to. It was that kind of a comment, and I thought, we need more of that at the younger group, because like I said, this is the seniors, but I was very impressed with their tuck shop.
And people are often surprised that if you put an apple and an orange and a bag of chips and a chocolate bar, the kids will more often go for the healthier choice now, because they're getting that education at school as well about healthy choice and food policy, and yeah, and they feel better, and yeah, it's just a good choice. We do have just a handout here. This is a sample policy and a little bit of information of the Chester policy that they have. This is just a sample. If you were to support us in developing a policy, it could, you know, you could take some of this, you could take some of it away. You can change the numbers. It's your own policy.
Now, we will not be making a decision this evening.
No.
We hear, and our decision will be made by next council.
Okay, great.
Okay? I'm not gonna say it won't be brought up in committee of the whole and the decision will be made, but it's always at committee of the whole, it's recommended on to council. So, just so you know.
Okay, great.
So if you don't hear from us for 2 or 3 weeks, it's not because, it's because it will be on the agenda to follow it forward. But if there's no further questions, I want to say thank you to everyone. We appreciated it. I think Dark's was longer.
Took us longer? I don't think so.
I think so.
We had a couple slides. I think we might have talked more. We have more social chat.
Okay. Maybe that was it. But I want to say thank you. I think it's something we need to look at.
Well, thank you for having us. We really have enjoyed coming and presenting to you, and it's been something we've really enjoyed working on together as a committee for the past year since we started in June, I guess. Yeah, so we're hoping to move forward with this. Thank you very much.
Thank you.
If you'd like any other information, or we can provide you with any other research or anything, just if you have Kara's contact, and then she can forward it on to the committee as well. So, thanks.